AFMC is really known.
And also make sure
Hello and welcome into this week's edition of AFMC TV. We're glad you're joining us. You know, when you have a pulled muscle or maybe you've broken an arm, and oftentimes you might have some type of therapy, like physical therapy, that gets prescribed. Well, did you know that after having a heart event, there's rehab for your heart too? And joining me today to talk about that is Amanda Xaysuda from Arkansas Heart Hospital, and we're talking about intensive cardiac rehab. Thank you, first of all, for joining us today.
Yeah.
So what is intensive cardiac rehab, or ICR for short, or some people may just call it cardiac rehab? What is that?
It is a medically supervised comprehensive program consisting of education and exercise. It's designed to bring recovery and an improvement in overall health and heart health specifically to cardiovascular patients. It's specifically designed for patients that have had a recent heart procedure like bypass grafting, stenting, those that have really had any type of heart surgery or a recent event like a heart attack, or those that have congestive heart failure or stable angina are also candidates for cardiac rehab.
So tell me a little bit about the program if someone's not familiar, because I heard you mention exercise. And are patients nervous if they've just had work done on their heart to start working out their heart?
Yeah, well, we hear that from patients a lot when we go to talk to them at the hospital and tell them about what rehab is and kind of what they're getting into. And so it can be scary, especially whenever you've just had all of that done. It can be pretty traumatic. And we actually see patients come in a lot of times with their heart pillow, or because we see them 2 or 3 weeks after their surgery. And yes, they're scared, but it's a medically supervised program. So these patients come in and we hook them up to telemetry. So we're watching their heart rhythm as they're exercising. We have a comprehensive team of nurses and clinical exercise physiologists, a physician on staff that all kind of work together to make sure that it's a safe environment for the patient.
So if I'm a patient and I'm coming in, take me through, what does that first day look like, and what type of exercises might I be doing? I mean, you and I both are runners, but I'm guessing I'm probably not going to run on my first day there.
Not typically, no.
Yeah, probably not.
So the first day, we really just want to get to know the patient. So what brought them to us in the first place, or led to their event in the first place? We have them do an exercise tolerance test. So we do hook them up to a monitor and have them do a little bit of an exercise test. It's not a maximum stress test, so usually no running. But we want to see how their heart responds to a little bit of exercise. There's a myriad of questionnaires that we give and talking about medications, and because it's a holistic program. So everything that got that patient there to us in the first place is going to be addressed. And that first day is how we design the rest of their program. Every patient that comes in, the program is very individualized to what their needs are and their limitations are and what goals that they have. And so that's where we start.
I love that. When I think about exercise, of course, I think of treadmill or biking, and I would suspect that maybe there is some of that, but are there other classes too?
Absolutely. We focus a lot on functional exercise, so it's not just a treadmill or a bike down in the basement that you work on. We do group classes. So we have multiple patients that went through the same thing that are there at the same time, working with a coach and on different machines. So it could be your standard machines, but we also have things for patients that have limitations so that you can actually wheel a wheelchair right up to the machines. Okay. We have things specifically designed for upper body only, like an arm crank. But the functional movement, that's a real big piece of the program, because our true purpose is to get patients back their quality of life. Yeah. And so we ask them, what do you want to be doing? And if it's someone that wants to be able to carry their own groceries, that's what we're going to work on when they're there with us. If it's someone that wants to go to Disney with their grandkids, whatever that thing is, those are the exercises that we work on with them.
But it's not just exercise, right? What are some of the other areas?
Yeah, it's everything. It's holistic. And so we do education every time the patient comes into us. By the way, we see patients usually at least 3 times a week for about 12 to 18 weeks. So they're with us a lot. Yeah. They do exercise and education. The education is very hands-on. So we have a chef that does live cooking demonstrations. That's usually the patient's favorite part, where we actually cook the food in front of them, let the patients try it, and not only send them home with the recipe, but also instructions on where to find the ingredients in the grocery store. We just want to make it as easy as possible for the patient. We do health coaching too, so we talk about stress reduction, understanding medications, again, kind of all of those things that are involved, because it's a true lifestyle change.
Now, are these patients, can someone come with like a caregiver or a spouse or is it just with the patient themselves?
No, absolutely. They can bring somebody with them, and we really highly encourage that, because we want to make a permanent change with these patients. And that goes back to their home too. Yeah. And so if they can bring someone with them from their home that can sit through the education and go through the program, exercise right along with them, learn the things that we're teaching them, it's going to be more of a permanent impact on their life.
So February, of course, we know is Heart Month. And so there's also a dedicated week for cardiac rehab. Talk a little bit about that, and why is cardiac rehab kind of a big deal, like where the state is concerned?
It is a big deal. So the second week in February every year is Cardiac Rehab Week. We use that week to celebrate our patients. So we have super fun games that we play all week. The cooking demo that week is a make your own pizza. So that's really fun. It's for celebrating our team too, and our coaches that work with these patients every day, but really to bring awareness to what cardiac rehab is and for providers, how to get their patients in to see us. Cardiac rehab is really underutilized, especially for our state. Only 10 to 20% of eligible patients receive a referral for cardiac rehab. Wow. Even though it's been proven, the benefits of cardiac rehab have been proven over and over again. Actually, the American Heart Association and the American College of Cardiology lists cardiac rehab as a class 1 indication or recommendation following specific procedures like bypass surgery or valve repair replacement. But patients aren't being referred, and it is something that's really important to help patients be able to recover. But there's other benefits too. It really saves lives. It keeps patients from it reduces the chances of patients being readmitted to the hospital or having a future procedure or a similar event. When patients graduate our program, and we actually roll out a red carpet, so they graduate.
It's a big deal.
But we see patients come off of their medications. We see patients graduate with normal blood pressures, come off of or lower their A1C values, and really just get back their quality of life.
That's so important. So in our final moments, I do want to ask, if someone has had a heart procedure and they didn't have it at Arkansas Heart Hospital, are they eligible, or is it only for patients at Heart Hospital?
No, not at all. Any physician can refer a patient for cardiac rehab. Okay. If you are a physician in Arkansas and you're not referring your cardiac patients to rehab, you really should be.
It sounds like it.
The event didn't have to be done at Arkansas Heart. Our team really serves, and how we look at it at Strong Hearts is that we're the eyes and ears for the physician that sent the patient to us. So we're seeing these patients right after their event, sometimes before their follow-up appointments, and we can keep an eye on their heart and catch things early and hopefully report that back to the physician instead of the patient ending up back in the hospital.
And is there a length of time? If someone had had a procedure 10 years ago, do they qualify? Or if they had it 10 weeks ago or 10 days ago, then they qualify?
That's a great question. We like to see patients 2 or 3 weeks after they are discharged from the hospital.
Okay.
But a lot of people don't know if a patient had a bypass surgery or an event 5 or 10 years ago and never did cardiac rehab. Research has shown that there are still benefits even that long
No kidding.
after your event.
Okay. All right. Amanda, thank you so much for joining us today.
Thank you.
And thank you so much for joining us. We'll see you back here next week for more AFMC TV.